Hi everyone, these are anatomy and physiology videos for healthcare students. In this video, we'll be discussing respiratory volumes and calculations. We're looking at a graph of respiratory volumes. These can be measured in a doctor's office using a machine called a spirometer, or sometimes in the hospital, a respiratory therapist may arrive after surgery with a spirometer for a patient to use to re-strengthen the diaphragm. So respiratory volumes are often calculated for males and for females separately because we have different average volumes for each sex. So in looking at this graph, we are looking at only a few things here. Let me mark the items that we're going to focus on in this video. So when you look at this volume of tidal volume sounds like the tides of the ocean going in and then going back out. That's normal quiet breathing. So as you breathe in and out, that is about 500 milliliters of air that is exchanged. So let's take for a moment and think about Halloween. A lot of people wear scary costumes. Somebody walks up to you, they tap you on the shoulder, you turn around and you're really frightened by what you see. You are breathing along. All of a sudden, as you were inspiring, someone scared you, so you took in as much air as you could through an inspiratory reserve volume. That's called the IRV. Well, notice that's a great amount of air that you've just pulled in. It can be as much as around 2 liters of air that you suck in or inhale over and above what is a normal tidal inspiration. Well, you then realize, oh, that was just a friend, and a big sigh of relief. All the air that's in your lungs go back out, except for there's a portion that you can't exhale. So what you've exhaled out is called the expiratory reserve volume. It's what you can forcibly exhale be above and beyond the normal tidal expiration or exhalation. Notice, however, there's a bit at the bottom of the screen called a residual volume. That is something you can't exhale. So even though you could inhale potentially like 2 liters of air, you're only going to force out around 1 liter through your expiratory reserve volume. So what happens to that remaining liter of air or so that's still hanging out in your lungs? That is going to continue gas exchange. So the residual volume cannot be measured with a spirometer, and it is not showing up as actually part of our respiratory volumes graph. So we assume it's staying in the lungs to maintain gas exchange. So you can force in about twice what you can force out when you're breathing forcefully, inhalation versus exhalation, creating those IRV and ERV volumes. Well, if you want to know how much air can potentially be exchanged, we can do a vital capacity calculation. Vital capacity includes 3 things: the exchangeable volumes of tidal volume, IRV, and ERV. Now, if you look at total lung capacity, that's both exchangeable and non-exchangeable air. Keep in mind, residual volume is not going to be considered exchangeable. That's the air remaining behind in your lungs to maintain gas exchange. So total lung capacity is tidal volume, IRV, ERV, and residual volume. Or make it simple. Total lung capacity is just vital capacity plus that extra residual volume. So here are those equations written out. Notice we've abbreviated all of those capacities here, or volumes that we're measuring. Just talking about some averages. Average vital capacity in a male is around 4.8 liters. Females, a bit less, around 3.1 liters on average. For both males and females, however, the normal tidal volume is around 500 milliliters of air. That's about a half liter that we can exchange just with normal quiet breathing. IRV stands for inspiratory reserve volume. So as you're sitting quietly, having normal breathing, at that point, you take a breath of air in as much as you can. That's the inspiratory reserve volume. You return back to normal quiet breathing. Expiratory reserve volume, you'll notice, is approximately half. So by doing the calculation, we figure that the remaining air is left in your lungs for gas exchange. So when you talk about total lung capacity, we're looking at approximately 6 liters for males, approximately 4.2 liters for females. Keep in mind that total lung capacity is both exchangeable and the non-exchangeable residual volume. Let's take a look at some respiratory volume calculations. You know, sometimes they may give you different volumes and want you to solve or calculate for one of those values. So I've given you a tidal volume of 500 milliliters, an expiratory reserve volume of 1,000 milliliters, and a vital capacity of 3,900 milliliters. So if we start with this familiar equation, all we need to do is algebraically rearrange it and solve for IRV. So subtract away your tidal volume and your ERV, and now that will isolate for you that IRV. Plug in your numbers. Do the math. So 3,900 is vital capacity, 500 is tidal volume, ERV was 1,000, so 3,900 minus 500 minus 1,000 leaves us with 2,400 for this particular IRV. Let's do another one. Given these values, let's calculate vital capacity and TLC. So keep in mind the vital capacity is just the exchangeable air, tidal volume, plus IRV, plus ERV. Just plug in your numbers. You get 2,800 milliliters or 2.8 liters. Now, let's do the calculation for TLC. TLC is exchangeable air plus the non-exchangeable residual volume. Let me give you a moment to jot that down and get that in your calculator. All right, so what you should get is around 4,000 milliliters, or just simply 4 liters, and that will be your answer for the total lung capacity. Here's one more. Let me give you a moment to do the calculation, plug in those values, get your final TLC. Okay, and what you get, you might compare back against an expected TLC. So for instance, if an adult female's TLC is expected at 4,200 milliliters or 4.2 liters, then you might compare your value and determine, is your value as expected? Is it higher than normal? Is it lower than normal? So here's the calculation. We ended up getting 4,300 milliliters or 4.3 liters. So our calculation is higher than normal. One final thing for us to consider are some disorders: obstructive and restrictive. Obstructive disorders deal with difficulties breathing out. Chronic obstructive pulmonary disorders like bronchitis, asthma, emphysema deal with issues of getting the air out of the lungs. I just keep the O's together: obstructive and out. The difficulty is breathing the air out. So we just got through talking about these 4 volumes: IRV, TV, ERV, and residual volume. Of those 4, which one involves forcing air out of the lungs through forced exhalation? ERV, right? Okay, so if you're dealing with a decreased ability to exhale out the air, then most of the air remains in the lungs as residual volume, and your ERV is actually decreased. So notice the obstructive pattern. You've got a larger residual volume and a smaller ERV. Now let's do the other side. Restrictive disorders restrict airflow in. Pulmonary fibrosis, obesity, for instance, can restrict airflow in. So the difficulty here is breathing in, going back to those 4 volumes. The case where we're trying to bring as much air into the lungs as we can is IRV. So if we're restricting inflow, we're restricting or reducing the inspiratory reserve volume. Best of luck with your calculations. Please reach out in the comments if you have any questions. And if you like this video, please follow my channel. Thanks for watching.